Today I'll be talking about objectives of impression making. The contents are retention, stability, support, preservation of residual structures, and aesthetics. Definition of an impression is a negative imprint of an organ structure used to produce a positive replica of structures to be used as permanent record or in the production of a dental restoration or prosthesis. So the objectives of impression making are retention, stability, support, preservation of residual structures, and aesthetics. Now retention. The definition of retention, that quality inherent in a dental processes acting to resist the force of dislodgement along the path of placement or insertion, and it is related to the force that resists the force of gravity, adhesiveness of food, and opening of the jaws. The process of obtaining denture retention begins with impression making. Factors affect retention: anatomical factors, that size of the denture bearing area. Now retention increases with the size in this with increase in the size of the denture bearing area. The average size of the maxillary denture bearing area is around 24 centimeters square, and that of the mandibular denture bearing area is 14 centimeters square. The tissue displaceability. The displaceability of the tissues affects the retention of the denture. The tissue displaced during impression making will rebound during the function and lead to loss of retention. The physiological factors. The amount of consistency of saliva affects retention. The thin, watery saliva affords best retention, and the excessive saliva that is thick and droppy accumulates between the tissue surface of the denture and the palate, leading to the loss of retention. The absence of saliva, that is xerostomia, affects the retention and can also cause irritation and soreness of the denture bearing tissues. The physical factors. Adhesion. Adhesion is defined as the physical attraction of unlike molecules to one another. Saliva is present between the denture base and the mucosa. It contacts with both these surfaces, creates and causes the adhesion, which is achieved by a conic force between the salivary glycoproteins and surface epithelium of acrylic resin. It depends upon close adaptation of the denture, size of the denture bearing area, type of saliva. Adhesion also plays directly between the denture base and the mucosa in case of xerostomia or lack of saliva, but this leads to ulceration and abrasion of the mucosa, as explained. Now cohesion. It is defined as the physical attraction of the molecules of one another, like molecules of one another. This occurs within the film of saliva and aids in retention. As viscosity of saliva increases, the greater is the cohesion, but very thick mucus saliva can physically push the denture out, resulting in the loss of retention. As explained, the interfacial surface tension. It is defined as the tension or resistance to separation possessed by a film of liquid between two well-adapted parallel surfaces. It is dependent on the ability of the liquid to wet the surfaces. The wettability of fluid is inversely proportional to the surface tension of the surfaces. This material demonstrates less wettability than oral mucosa, with heat-cured resins showing better wetting than autopolymerized resin. But once coated with salivary pellicles, the surface tension of the denture-based material increases and contact increases. The interfacial surface tension can be calculated by Stephenson formula. This means greater the space, interfacial surface tension is less. Closer the adaptation of the denture, greater is the interfacial surface tension and retention. And the greater the radius, greater is the interfacial surface tension, and greater the area covered by the denture, then greater is the interfacial tension and retention. As explained, capillarity, that quality of state because of which surface tension causes elevation or depression of the surface of a liquid that is in contact with a solid. Capillarity causes the thin film of saliva to rise and increase its contact with the denture base and the mucosa. Close adaptation of the denture base to the mucosa is very important for the capillarity to provide effective retention. Atmospheric pressure. This can help resist dislodging forces have if the denture have an effective border seal. The peripheral seal or border seal is defined as the contact of denture border with the underlying or adjacent tissue to prevent the passage of air or other substances. As we can see about in this now gravity, this force, it's a natural force, and it can aid in retention of the mandibular denture, especially when there is more weight and the other retentive forces and factors are marginal. And the gravity force affects the maxillary denture inversely. Mechanical forces. First is undercut. The moderate undercut enhances the retention because of the resiliency of the mucosa, provides a natural retention to the maxillary or mandibular cast. Now, examples are unilateral tuberosity undercuts and undercuts in the maxillary premolar area, distal lingual areas, and lingual to the midline of the mandible. Severe undercuts covered within mucosa compromised retention and need to be surgically eliminated. Now, danger adhesives. These commercially available products enhance retention by increasing adhesive and cohesive properties and by eliminating voids between the denture base and basal seat tissues, as we explained earlier. Now, suction chambers and discs. These have been used to create a negative pressure in the palatal surface of the maxillary denture, thereby enhancing the retention. They are best avoided due to their potential to cause papillary hyperplasia because of the suctioning effect on the mucosa or the palate. The continuous pressure or suction action on the mucosa tends the tissues to outgrow or grow more. On muscular factors, the oral and facial musculature and tongue supply supplementary retentive forces. For this to be effective, the teeth must be positioned in neutral zone between the tongue and the cheeks, where the force from cheek and the tongue is minimal or at equal. Now, the polish surface of the denture should be properly contoured. Now, denture bases must be extended to cover maximum area. Occlusal plane must be at correct level. Now, the next, stability. The quality of removable denture process to be firm, steady, or constant to resist the displacement by the function, horizontal or rotational stresses. The factors affecting stabilities are first vertical height of the residual ridge, and the stability decreases with the loss of vertical height of the ridges. So less the residual ridge resorption, the more stability it is. The quality of the soft tissue covering the ridge. It can be flabby ridges provide very poor stability. And adaptation of the denture to the tissues. The close adaptation of the denture to the basal seat tissue is very important to ensure the proper stability. An accurate impression is essential to achieve this. Now, occlusal plane. The occlusal plane should be oriented parallel to the ridges. Should divide the interoral space equally. Inclined occlusal planes will promote sliding forces and cause instability. Now, teeth arrangement. Setting the teeth in the balanced occlusion and in the neutral zone promotes the stability. The balanced occlusion is done mainly to achieve the stability of the denture. The contour of the polished surface. The polished denture surface should be in harmony and with functioning of the oral muscles to promote stability. Now let's talk about support. The resistance to the vertical forces of mastication, occlusal forces, and other forces applied in the direction towards the basal seat tissues. That's support. To provide adequate support, the denture base should cover as much denture base bearing area as possible. This distributes the forces over a large area and is known as snowshoe effect. So the denture bearing area should be most like vast as possible to provide these neutral effects. Now preservation of residual ridges. The preservation of remaining oral structures is vitally important to long-term success of the denture. The accurate impression using a selective pressure impression technique that places the pressure only on the stress-bearing areas is important for this preservation. Now, aesthetics, the last point. The denture border and flange thickness are dependent on the amount of residual ridge loss and varies with each patient. Reducing or increasing the thickness of this area leads to poor aesthetics. Border molding ensures adequate thickness in this region. Thank you.